We developed TUNET, first of all, for local applications. When I started, it was 10 hospitals in 8 countries. So HUNET was a very small project when I started. So it's to promote local use for local applications. And secondly, to promote national and international collaborations. The local is more important because for 2 reasons. One is at the local level, where you have the infected patients and the hygiene issues and the policy issues. You need to treat these patients locally. The other reason the local is so important is if there's no value to the local data generators, it is not going to survive for national and global surveillance. So to have a global system, there has to be some value to the laboratories and the institutions that generate the data. Since I've been involved in surveillance of resistance, I think we have really made a lot of improvement in the quality of data, of laboratory data, knowledge and interpretation of those data, but we are still faulting on using those data to support interventions. One of the good things in the last 20 years is the growing recognition and involvement of national health authorities in data collection, in data analysis, and in data use. You see that in the 2010s World Health Day, the UK AMR review under Lord Jim O'Neill. The AMR review was about the cost of inaction. The World Bank report was about the cost of action. What does it take to do these interventions? So there's a much more holistic sense of bringing together all of the different sectors on the data collection side, but also on the data use side, the media, educators, researchers, industry, patient advocacy groups. For me, it comes down to we've done a good job, a very good job of improving our ability to capture and standardize and understand data. What is still missing in many countries, some are much more advanced, others further behind, we need to take those data and translate them into action. Action for capacity building and continuous quality improvement so that the quality of the data and the knowledge and the interventions is improving, and translating data into action. Advocacy and awareness for generating funds and commitment, governmental and non-governmental commitment, disease prevention, improved use of existing therapy options, and decreased transmission of resistant pathogens. So what needs to be done in the future? We need to identify what actions are needed and what data are needed to support those actions. What data exist? What are their strengths and their weaknesses? What are the information gaps where we need to dedicate some new resources? What partners and skill sets are needed? And what are the costs of action? What are the costs of inaction? At the beginning, the focus was microbiology and laboratory and standards and quality control. And what's been a pleasure is to see growing acceptance by governments in their role in this, by patient advocacy groups, by governmental, non-governmental organizations, and a commitment not only to collect data, but also to utilize the data. So there's been a maturation of an understanding of the role of AMR surveillance in the broader context of understanding and containment.